With a changing pandemic, the worst-case scenarios change too.
This is crisis standards of care for hospital-based decision-making, which is not currently active.
Pulmonologist Dr. Anush Mehta drafted changes for the crisis standards of care document to fit what could happen in hospitals if the pandemic continues to put a strain on resources.
These are different than the ventilator decisions about who's the most likely to die. This is who's the most likely to be fine without the intervention.
We almost certainly are going to have to grapple with this somehow.
Bioethicist Dr. Matt Winia says because of that change from predicting mortality to predicting who will be okay without certain services, socioeconomic status needs to come into play.
I would hate to use a criterion that was purely clinical and end up sending someone home who's homeless and keeping someone in the hospital who is wealthy and could very well afford to have someone come in and check on them at home.
The experts at Thursday's meeting also talked about vaccination status and whether it should be a factor if hospitals have to prioritize care.
I think a lot of people have a gut reaction about this idea about people that have chosen not to get vaccinated are burdening the rest of the system. Our ethical principles are to save the most lives, not to evaluate social responsibility.
Dr. Mehta believes, at least for now, vaccination status should not be a part of the algorithm. But he urged the other experts to email him if they didn't feel comfortable sharing their thoughts publicly. Katie Eastman, 9 News.
The current crisis standards for staffing give hospitals flexibility to move staff, offer guidelines for family members to help instead of workers, and provide legal protections if and when care isn't up to normal standards.